Hello ladies and gentlemen, and welcome back. I'm Stuart Bishop. I'll be doing this tutorial for you. This is on the endocrine system as presented by Professor Sue Washburn and Professor Tony Anno at Washburn University, fall of 2015. I'd just like to begin by saying that the endocrine system for a lot of us is one of the more mysterious systems. It's not a system where the glands are highly visible. They're sort of hidden throughout the body or deeply placed throughout the body. And the effects of the hormonal system are sometimes dramatic, but oftentimes they're very subtle. As we go through this presentation, I'd like you just to keep in mind that the hormonal system basically is there to affect other systems. That's really the key. You start looking like that, I think a light will go on for you. When you think about it, when thyroid hormone, for example, is secreted, the thyroid is just a small little gland right here, but the hormone affects almost every cell in the body. It can accelerate the rate of metabolism of every cell in the body, or if you have a shortage of thyroid hormone, for example, your overall metabolism will go down. And that just gives you an example of how broad the effects of this system really are. And that's just from one hormone. Now, the tools we're going to use today, of course, are our McCants book. I'm going to go through this book and show you several slides that I think are really important to help to get you up to speed. And I also have a few slides of my own here that I've used to introduce the subject to people. And this unit, perhaps as much as any other unit, you will benefit by starting out with an idea of the anatomy itself. Before you start getting into the various diseases, I really want you to get a solid foundation for the anatomy. So that's where we're going to start. We're going to introduce the basics of the hormonal system, and I'm going to show you some shortcuts to where you can kind of summarize the entire system on just one or two pages. And then we're going to start to look at what happens when you're either low or high on these various hormones, and then what sort of disease conditions can develop. So with that in mind, I'm going to go ahead and turn the camera towards the screen here, and we'll go from there. And of course, as with all of these presentations, please have your PowerPoint out in front of you so you can get maximum benefit out of this presentation. Okay. Ladies and gentlemen, I'd like to start with the McCants book and go through a few things that I think are very, very, of course, obviously all of these chapters are tremendous. They do go into somewhat greater detail than maybe you need for an introductory class, but that's really all to the good. Just a simple chart here. This first chart, of course, shows you the major glands of the endocrine system. And I really want you to start with an idea of an understanding of the hypothalamus and the pituitary. If you just start there, don't go beyond that. Because all of this activity, or the majority of it, is triggered off of activity from the hypothalamus to the pituitary. And before we go any further, just stop and ask yourself for a moment. Where is the hypothalamus and the pituitary located? It's right in the middle of the brain. And that means that this part of the brain is getting signals from sensory information and chemical feedback that is ascending, but it's also getting feedback from the thinking brain out here in the frontal cortex area, and also from the feeling brain that kind of surrounds it, the so-called limbic system. So we can really think that the endocrine system, in some ways, the control of it is right in the center of the patient, really. A couple of other things for you to look at. All of these charts are good. Some of them are in your PowerPoint, so I'm not going to point them out again. But over here, you see the idea of upregulation and downregulation. And this is an important idea. You'll notice that this is a cell. Both of these are cells that are receptive to a hormone. And on the membrane surface of the cell, it's got a receptor there. Well, if we have what's called upregulation, the cell will start producing more and more of these receptors. And that cell will be more responsive to the receptor. This is particularly important when you look at diabetes, and the certain cells become what we call insulin insensitive. And so it takes more and more insulin to stimulate the uptake of glucose. That's one of the etiologies of diabetes type 2. Okay, now in downregulation, you see where a cell becomes insensitive to the hormone. The cell begins to lose receptors. And it takes more and more hormone to get the same effect because you don't have as many receptors for it. So this is kind of an important idea to keep in mind. Of course, like I say, all these charts are important and useful, but here is one that really gets, again, I really want you to start out with a strong understanding of the hypothalamus and the pituitary. And here you have the hypothalamus right in this area, and then then right below it you have the anterior and posterior pituitary right in this area. And then this is an expanded view of that. There's your hypothalamic area here, and then you have your anterior and posterior pituitary. Very, very important to understand this. And again, it's right in the middle of the brain. It's going to be receiving cognitive signals from above, emotional signals from right around, and it's going to be getting positive and negative feedback coming up from circulating blood. Okay? Very, very important idea. Well, and I have another few charts to show you this, and by the time you're finished, you'll probably have seen more of these charts than you want to see. Very, very useful drawing right here, again, illustrating the relationship of the hypothalamus to the pituitary. And by the way, the thalamus, this is a very, very important region of the brain. This is an area that oftentimes is the first to receive ascending signals in the neural system. If you get any kind of sensation, it will arise up to the thalamus, and then from this area, it will decide whether or not you need to send that up to the higher brain so you can be thinking about it, or maybe it's something you instantly recognize, and then you can just and then you will just get a signal to respond. So, and this area, of course, is just exactly attached to the hypothalamus, and again, you have the pituitary right below it. Now, importantly to this drawing, you have this area called the stalk. I want you to look at that. And the stalk is an area where hormones will and neurotransmitters will come from the hypothalamus down into the anterior and posterior pituitary. And the important thing is, imagine if there was a disease right there at the stalk. Well, that would stop the flow of all compounds. However, if there was let's say a small little tumor right here in one area of the anterior pituitary, then only that tissue would be affected. And let's say that tissue secretes growth hormone, for just as one example. Then you might have an excess of growth hormone, and all the other hormones might be perfectly fine. So just kind of keep this structure in mind as we move along in this discussion. Over here you have the hypothalamic hormones. This is a list of the hormones that come off of the hypothalamus. And notice where they target. They virtually all target the anterior pituitary, and you have TRH, GnRH, GHRH, CRH, substance P, and prolactin releasing factor. And I'm going to demystify all this for you in about 1 minute. But this is an important table to familiarize yourself with, and all of these hormones are going to be coming off the hypothalamus and down to the anterior pituitary. And then from there, you can see the various actions. Once these hormones hit this tissue, it will stimulate the release or inhibit the release of something. And these things will then be released from the anterior pituitary and go down to additional target tissue. Now, these hormones listed right here that come off the anterior pituitary are all right here in this next table. So that's how you can kind of link up those two tables and kind of start to demystify this stuff. And we're going to have to become familiar with ACTH, GH, TSH. We're probably not going to be doing too much with FSH and LH, but it's good for you to know that they also come off the anterior pituitary. And then remember, we also have that posterior pituitary where we have the release of ADH, or antidiuretic hormone, and also oxytocin. Okay, just kind of, again, all of this is very, very useful. I encourage you to delve into as much of it as you possibly can. But those are just some of the high points to get you familiarized with the anatomy, because that's where we're going to start. Now, in the next chapter, in terms of alterations of hormonal regulation, this is going to be very important because it's going to delve, this unit delves in greater detail into each of the diseases that you're going to have to become familiar with. Of course, this is acromegaly. You can see the enlarged features. Gigantism. Now, gigantism occurs if the patient is exposed to excess growth hormone before the long bones fuse. If they're exposed to it afterwards, then they start, instead of growing lengthwise, they grow widthwise and begin to develop those thicker characteristics. Now, this is a really good chart here of hyper versus hypothyroidism. Over here you have the effects of not having enough thyroid hormone, and that's shown on this side. And then over here is having too much thyroid hormone. You can kind of see how each one of these body tissues is affected. Really nice chart in one slide. And you will see in your career a whole lot, especially of hypothyroid there on the left-hand side. This is a really good diagram here as to the causes of hypothyroidism, because keep in mind that because we start with the hypothalamus and then we go to the anterior pituitary and then we go to the thyroid itself, there are three possible places where you can have a disorder. Now, if you have a disorder at the thyroid itself, that's called primary thyroid malfunction. But if the problem is up higher at the level of the pituitary, that is essentially, normally that's called secondary. And I notice they've looped them both together as secondary, but I would call this secondary. And then if it's even higher, if it's at the level of the hypothalamus, sometimes you hear that referred to as tertiary hypothyroidism. But you'll notice the really important thing for you to note is this last line. For example, if you have a low thyroid hormone, you're going to have low TH but high TSH and TRH. And we'll get into this in a moment, demystify this real quick. But you need to know that if you look at somebody's labs and their TH is low and their TSH and TRH are high, that indicates that the thyroid is not putting out TH, even though it's being stimulated by TSH and TRH, okay? Now, if the problem is at the level of the pituitary, remember, the pituitary puts out TSH. And so if the pituitary is not putting out TSH, you're going to have not too much TSH coming out. And of course, because there's not much TSH hitting the thyroid, you won't have much TH. So both of those will be low. But then the feedback to the hypothalamus, and I'll show you that in a moment, the feedback to the hypothalamus is going to say, I've got low TH, and so the hypothalamus is going to start putting out more and more TRH, okay? Maybe you're a little confused, maybe you're starting to have this clarified a little bit in your mind, but I assure you, if you just stop and think about it just for a moment, this will become clearer and clearer. And it just takes time to kind of walk through this. Now, the last situation is possible that the hypothalamus is malfunctioning. If that's the case, you're not going to have TRH coming, because remember, that's what's secreted by the hypothalamus. Okay, and so if there's no TRH coming to hit the anterior pituitary will not secrete TSH, so that's going to be low. And if there's no TSH coming down to hit the thyroid, there won't be much thyroid hormone, so they're all going to be low. Okay, so this is, you may see a question or two about that, about primary versus secondary hypothyroids on your test. Okay. And then again, of course, the rest of this just kind of goes into greater detail on those diseases. The fantastic book. Now, ladies and gentlemen, here are some slides that I've shown in the past that have come from a different source, but I think hopefully you can maybe pause the YouTube and focus in on these. But here we have another chart illustrating the relationship between the CNS, which is the brain, and the hypothalamus, which is kind of right in the middle of the brain. And remember, the hypothalamus is going to be receiving signals to and from the thinking brain and the feeling brain. And the hypothalamus will send these chemical messengers to the posterior pituitary and to the anterior pituitary. Now, if it does that, the posterior pituitary is going to release oxytocin and ADH, and we'll talk about those in just a moment, what they do. But the anterior pituitary is going to release growth hormone, and notice it has some target cells down here, and we'll talk about what those target cells are. It will also release follicle-stimulating hormone and luteinizing hormone, and the main targets of this hormone are the testes in males and the ovaries in females. Okay? Now, if the anterior pituitary releases TSH, the main target there is thyroid hormone. And notice this little dot right here. This is what we call feedback, and we'll talk about that in just a moment. Okay, now the last hormone that we'll be looking at is ACTH, or adrenocorticotropic hormone. That's released by the anterior pituitary. If that hits the cortex of and it's cortico, so remember the adrenal has two parts. It has the cortex on the outside and it has the medulla on the inside. Well, the medulla releases epinephrine, but the cortex releases cortisol. Okay, so the ACTH will come down, hit the cortex of the adrenal gland, which sits right on top of your kidney, and then this will release cortisol. Okay, now, importantly, keep in mind these feedback loops. If, for example, ACTH, let's just take that one pathway. The hypothalamus decides, for whatever reason, to release TRH, thyroid-releasing hormone. So that comes down, hits the anterior pituitary. The anterior pituitary is stimulated to release ACTH, which then comes down in the bloodstream and hits the cortex of the adrenal gland and releases cortisol. Now, once that cortisol is circulating, it's going to come back up here, and the hypothalamus and anterior pituitary will detect it. It will detect that the level of cortisol has increased. And once the set point has been reached, the hypothalamus and the anterior pituitary are satisfied, that, hey, we've got enough cortisol now, then this will start to turn off the secretion of TRH. So the idea is that when the levels of these things are low, they will have low concentrations in the blood, and they will stimulate these master glands to go ahead and release it. And once it's released, then the concentration will rise, and the message will be, hey, turn it down. We don't need as much anymore. Okay, now, that whole basic concept is illustrated in this slide. Again, you have that input from the central nervous system, from the brain. Here's the hypothalamus. And remember, the hypothalamus always releases what are known as releasing hormones or also inhibiting hormones. You'll see, so if it's a releasing hormone or an inhibiting hormone, it's almost always going to come off the hypothalamus. That will come down to the anterior pituitary, which will release something called a tropic hormone. And all tropic means is to build something, to create something, okay, stimulate something, as opposed to turning it off, okay? And the tropic hormone will come down to the target gland, and there are numerous target glands, but for example, the cortex of the adrenal that we just talked about, that's the target for ACTH. So ACTH will come down and hit the cortex of the adrenal gland, and it will release cortisol. And then that or any of these other hormones that are involved. It's the same pathway for all of them. And then, but if it were cortisol, for example, then it would come and it would have target cells that it would affect. And then once it affects those target cells, you get some kind of effect. Okay. And then once that is secreted from the target gland, it's going to come back with that negative feedback loop telling the anterior pituitary and hypothalamus, hey, we have enough of this stuff. You can go ahead and start turning off the release of it. Okay. Here's another close-up view. I really like this image of the anterior pituitary. Now, notice up here it says source of releasing factors and source of ADH and oxytocin. Well, that source is the hypothalamus. You can just write in hypothalamus right above that. Here is the stalk that we talked about that connects the anterior and posterior pituitary to the hypothalamus up above. And notice that I really want you to look at this list right here. Growth hormone, TSH, thyroid stimulating hormone, adrenocorticotropic hormone, FSH, LH, prolactin, and melanostimulating hormone. Okay? Those are all the hormones coming off of the anterior pituitary, and then coming off the posterior pituitary is ADH and oxytocin. Very, very nice single diagram here. And I also want you to notice that ADH and oxytocin are actually made in the hypothalamus and stored in the posterior pituitary, whereas in the anterior pituitary, these hormones are actually made right there in that anterior pituitary. Okay, a little nuance there that you may or may not see on a test, but it's kind of good to know. Okay, now this, ladies and gentlemen, is really what I want you to pause the YouTube and take a good look at, because this puts the entire system on one piece of paper, and you can handle one piece of paper to learn the basics of the hormonal system or the endocrine system. Okay, so the way this works is you have down the left hand side, there's the hypothalamus. All of this comes off the hypothalamus. Okay. All of these things come off the anterior pituitary, and there's basically 6 of them. Now, they all have endocrine target, or some of them have endocrine targets, like, for example, TSH targets the thyroid, ACTH targets the adrenal cortex. Growth hormone will target the liver, but it also will go direct to tissues. The FSH and LH will target the gonads, which are the testes in males and the ovaries in females, and then various compounds will be released from that. Now, in some cases, there is no intervening endocrine, there is no intervening gland. The hormone will go direct to the final tissue, as, for example, prolactin. So if the hypothalamus releases PRH, or prolactin-releasing hormone, that will stimulate the release of prolactin from the anterior pituitary, and that will go directly to breast tissue. Okay? The second pathway, if thyroid-releasing hormone is released from the hypothalamus, that will go to the anterior pituitary, stimulate the release of TSH. TSH will go to the thyroid. The thyroid will stimulate the release of the hormone, thyroid hormone, and then the target of that is many tissues. And you'll see that as we read through these diseases. If you have too much of this or hyperthyroid, you're going to have effects all over the body. Or if you have too little of this and hypothyroid, again, you're going to have effects everywhere. Now, CRH is cortico-releasing hormone. That's from the hypothalamus. That will be released and travel to the anterior pituitary, where ACTH is released, adrenocorticotropic hormone. And if that's released in the bloodstream, it will travel to the adrenal cortex, and it will stimulate the release of cortisol. Okay? And then cortisol will be released into the blood, and again, it will target many tissues with many, many effects. Okay? Now, on the growth hormone side, there are 2 hormones that are involved: growth hormone releasing hormone and growth hormone inhibiting hormone, or also known as somatostatin. And one of the conventions, ladies and gentlemen, is if you're going to have a stimulus, you show an arrow, but if you're going to have an inhibition, you show a line with a flat, kind of like a stop sign, if you will. And you have the same thing over here, prolactin inhibiting hormone, which is an analog of dopamine. And if that is released from the hypothalamus, that's going to block the release of prolactin from the anterior pituitary. Similarly, over here with growth hormone, if growth hormone releasing hormone is released from the hypothalamus, it will travel to the anterior pituitary, release growth hormone, and then there's two basic channels for growth hormone. One is it will target the liver, where something called insulin-like growth factors, or IGFs, will be secreted. And also growth hormone can go directly to tissues. And it about does what it sounds like it does. It helps to stimulate the growth and the development of the body, but also importantly, it helps the repair of tissues. So it has two very important functions. Now, over here you have gonadotrophin releasing hormone up here at the hypothalamus, and if it's secreted, it will travel to the anterior pituitary, where FSH and LH can be secreted, and then the endocrine target are the gonads, and then from there you have the androgens and the estrogens that are released, and again they target many tissues. Now, for our purposes, we're going to be primarily focusing, we're probably about finished with prolactin, we're about finished with the sex hormones, and the ones we're really going to focus on coming off the hypothalamus are the thyroid, the adrenal, the cortisol, and the growth hormone. Those are going to be the three that we're really going to look at. In addition, we're going to look at the parathyroids, which do not involve this channel. They basically are autonomous glands that are located on the posterior part of the thyroid, and they have functions primarily related to the calcium levels, and we'll talk about that as well. Okay. Now, with that in mind, ladies and gentlemen, we are going to turn to the class PowerPoint, and I think that by taking that 5-10 minutes out to refresh your memory about the system, it will really help to demystify everything else that we're going to talk about here today. So please have your PowerPoint out, and let's turn to the first page, which of course shows us all of the hormonous or endocrine system. And notice again that we have the hypothalamus and the pituitary right in the midbrain, and that we have all of these target tissues. These target tissues that will be targeted by the release. And also notice that also, for example, with growth hormone, that's going to target all of your bones and your skin. So by no means are these the final targets. Once the hormone is released, for example, once the adrenals release cortisol, that's going to go all over the body. And we'll get into all of that as we go through here. Mechanisms of hormonal regulation. How are hormones released, and how are they regulated? Well, some of them actually have patterns that go throughout the day, and some are just on a set cycle that we'll talk about. But many of them are based on levels of circulating substances. So, for example, if you have a high level of sodium in the body and you are hypernatremic, we are going to want to water that down. And so the way we do that is we secrete ADH, and that will retain water, and then that water will begin to return that elevated level of sodium back to a normal range. Okay, and then we'll look into all of this, but that's just one example. And the real key here is number 2, that they operate within a feedback system. And for our purposes, I think almost all of the hormones we're going to talk about today have a negative feedback. Now, some of the hormones related to fertility and ovulation have a positive. They actually feed on themselves. But I think most of the ones that we're going to be looking at will have a negative feedback. That is, when the hormone gets high enough in the blood, it will begin to turn off the secretion. Okay. Now, again, regulation of hormonal release, the chemical factors, depending on the levels in the blood, will affect whether or not we have too high or too low a concentration, and then that will affect what happens. The feedback system, again, that's really a very, very important feedback method, and that will be shown on your next slide here. And you saw this in your McCants book, but just to kind of refamiliarize, and this gives us the example of TRH, or thyroid hormone, the thyroid pathway. Here we are in the hypothalamus, and TRH is secreted from the hypothalamus. It will go down to the anterior pituitary and secrete TSH, and then the TSH will come down and affect the thyroid. Okay, and then you have the negative feedback coming up here. The negative, as the thyroid elevates, as your levels of T4 and T3 increase, then you're going to get that negative feedback back saying, hey, we have enough, let's turn this off. Okay? So TSH will have a positive stimulus effect on the thyroid itself to produce T3 and T4, and once they're produced, it's going to have a negative feedback to say, hey, we have enough, we're at, and by the way, how much is enough? The body determines that, and a lot of that's determined up in the hypothalamus in what we call a set point. And sometimes, and it's oftentimes established by what the body needs. If, for example, thyroid hormone does a lot of things in terms of strengthening the body, increasing metabolism, and so forth. Somebody who is very active during the day may need that extra activity, and so the thyroid will adjust to that and will set a set point based on their level of activity. And then when that set point is reached, when we have enough thyroid hormone in the bloodstream, it will begin to turn itself down. Okay, again, you see this exact same chart that we've shown before. You go from the central nervous system of the brain down to the hypothalamus, down to and the hypothalamus will send those releasing hormones and the inhibiting hormones, and they will go to the anterior pituitary, which will then release a tropic hormone, which goes to the target gland, which then will secrete a final hormone, or I call it the ultimate hormone, and then that will go to various cells throughout the body and have the effect. The designated effect, and then you have those feedback loops. Very, very important way that this somewhat mysterious system regulates itself. Okay, hormone transport. You have water soluble and fat soluble hormones. The water soluble will just basically circulate free in the bloodstream. And they would go to bind with these target cells, with receptors on the target cells. The fat-soluble hormones will be usually attached to a carrier, and they will go ahead and circulate in the blood. But again, they ultimately all find the receptors, their target receptors, and then that creates the effect, the downstream effect. Okay, now what can go wrong? Okay, many things can go wrong here. There can be something wrong in the receptors, so that the cells, the ultimate cells, way down here, the cells down here in the tissues, stop responding to this stuff. That could be one thing. There can be something wrong inside the cells. There can be something wrong that's blocking, inhibiting, or antagonizing those hormones. There can be something wrong in the synthesis. In other words, up here, maybe there's something wrong in the hypothalamus so that these hormones are not being properly synthesized.